have basic fundamental needs for survival. Oxygen and water being the greatest of these needs. Without adequate fluid intake, death can even result. During today's video, we are going to look at hydrating our residents. Our residents consume fluids by the foods they eat and the beverages they consume. They actually lose fluids through a variety of ways. One being through urine and feces, through excreting fluid in that method, but also they lose fluid from their skin by perspiring and from their lungs by expiration. So during the course of today's video, we're going to look at some concepts about hydration, why it's important, and most importantly, what we can do as professional caregivers to ensure that our residents receive appropriate opportunity for hydration. For optimal resident health, there needs to be a balance between the amount of fluid the resident consumes and the amount of fluid that is lost. If the resident is losing too much fluid or not taking in adequate amounts of fluid, dehydration can result. Let's listen to Felicia as she tells us about the signs and symptoms of dehydration.
The most common signs and symptoms of dehydration can include muscle weakness or cramping, lethargy, when the resident just isn't feeling like their normal self and don't appear to have as much energy as normal, headaches, dizziness, nausea, fatigue. And nausea doesn't necessarily mean that they're vomiting. They just don't feel good and will express it in that way. I just don't feel good. My tummy is upset. Dry or sticky mucous membranes in the mouth. While you're providing oral care for your residents, if you notice dry and sticky mucous membranes, again, that should alert you to pay attention for signs and symptoms of dehydration. Skin that lacks its normal elasticity and sags or tense back into position after gently being pinched. For example, as you can see on my arm, when I pinch my skin, it will snap back into position. On a person that is dehydrated, when pinched gently, the skin will slowly drop back into position, and when released will often have a mark on their skin that looks like a tent. Another sign or symptom of dehydration may include decreased tears. Your resident may remark to you, "My eyes feel dry. I don't seem to have as many tears as I normally have." Decreased or absent urine output. Now, how would you be alerted to that? Well, perhaps while you're changing an adult brief, you may notice that the weight of the brief isn't what it normally is. You may notice a very strong or more strong odor to urine, deep rapid breathing, or an increased heart rate. Dehydration is a very serious condition, more than most people realize. Since seniors often have a decreased sense of thirst, it can affect seniors more rapidly than the average aged adult. The first step, if you are concerned that dehydration may be occurring in one of your residents, is to notify your supervisor immediately and follow your facility protocol.
Let's look at some reasons why a resident might have problems maintaining adequate hydration. The first problem we might encounter is a decreased desire to consume food and fluids appropriately. Now, there can be many reasons for this. It could perhaps be the medication that the resident is taking is causing them to just not care about eating or drinking. It could be an illness they suffer from. There can be many reasons that a resident simply is just not interested in eating and drinking sufficiently.
I find that when I give a resident a little glass, it's easier for the resident to be able to finish it and makes them feel like they accomplished more than when I give them a big glass that they can't finish.
For residents that have suffered with any form of urine incontinency, they may actually decide to cut back or stop drinking because they think it will improve their problems with incontinency. Now, actually, it's just the opposite. If residents are not consuming appropriate fluids, it can actually cause the bladder to spasm and have further episodes of incontinency. But a fear of losing control of their bladder, especially when around others, can actually cause some of our residents to pass up a beverage and say, no thanks, I'm cutting back on what I'm drinking. Lack of availability of favorite beverages. When residents were living in their own home, oftentimes they stocked their fridge with their favorite things to drink. When they move into a community, we may perhaps not have on hand the things that they enjoy most. Medical conditions and the medications used to treat those medical conditions can also cause problems with appropriate hydration. For example, you may have a diabetic resident who is urinating an excessive amount of fluids, or you may have a resident with a cardiac condition. The physician has ordered a diuretic to be used in the treatment of the cardiac disease. In fact, they're also losing excessive amount of fluids with those diuretics that could possibly lead to dehydration. Vision and visual perception problems can also be an issue. For example, a resident may be served water in a clear glass. They can't see that the water is actually in the glass and may perceive it as empty, so they may not drink sufficiently. Motor or dexterity problems can be a barrier when a resident is trying to consume fluids. If, for example, your resident has a severe tremor, it may be very difficult for them to consume fluids. It may be embarrassing. When they try to drink, oftentimes they may spill on the front of themselves, and so to avoid embarrassment, they simply stop drinking adequately, especially when other people are around. There can also be a number of transient problems that can contribute to inappropriate hydration. Bowel disorders. You may have a resident that is temporarily having a problem with diarrhea. During this time, they are losing excessive amounts of fluids with each bowel movement. You may have a resident with an elevated temperature, and again, the body is using fluid to try and maintain the appropriate body temperature. You may have a resident that has been started on a new medication that has affected their taste. Nothing tastes good, so for a while they just simply don't want to drink appropriately. Even though these are transient issues, they can cause severe problems rapidly, so we want to make sure we're monitoring our residents at all times. It's often these transient issues that can lead to healthcare emergencies. Residents with dementia have very unique problems related to hydration. Now, they can have any of the problems we've already discussed, but additionally, they may have issues related to anxiety or agitation. When a resident is feeling unsafe or insecure and they're highly anxious, the last thing in their mind often is to take a drink. They're busy, they're worried, they're concerned, and they just simply don't take time to sit down and enjoy a beverage. Dementia residents who are involved in excessive amounts of pacing may have a unique problem as well. Remember what we mentioned earlier, that as the body perspires, it is losing fluid. So when that resident is pacing excessively, number one, they may simply not sit down long enough to enjoy a beverage, but additionally, they could be losing fluid also just by perspiring because they're on the move so much. Memory impairment related to dementia can cause a resident, frankly, to forget whether or not they've taken a drink. So you may offer a beverage to a resident with memory impairment and they'll say, oh, no thanks, honey, I just had a big glass of lemonade, when in fact, they haven't had anything to drink for some time at all. Cognitive impairment can also cause a disconnection with need. For example, the resident may feel thirsty, they may even be aware that they are thirsty, but they're not connecting, I'm thirsty, with the need, I better go get a drink. So cognitive impairment can cause problems. Confusion is another issue. You may have a resident that was married to a gentleman that always drank bourbon out of a short little clear glass. Now today, you're offering that resident some juice in a short little clear glass. Well, unbeknownst to you, the resident may be associating that with drinking bourbon and may say, oh, no, honey, none for me, simply because she's confused. She received a different cue than the one you were trying to initiate with her taking the juice.
I find that it's best to know what the resident actually likes to drink out of, whether it's a cup or a glass, because if you give a resident something that they're not used to drinking out of, like a sports bottle with a straw, the resident's not happy with that. They're not used to drinking out of that. If they have their regular glass, then they're able to finish their drink with no problem.
Keep in mind, the dementia resident will not have necessarily the capability to explain to you why there is this confusion. They're simply just going to say, no, I don't want it. So something as simple as offering the juice in a different container may encourage the resident actually to consume the beverage. Tragically, a significant reason that residents are not appropriately hydrated falls on our shoulders. As professional caregivers, we're so busy doing other activities, we simply are not giving enough attention to keeping our residents well hydrated. Now, we would never intentionally provide substandard care. Let's look at some reasons why we might err in not offering the appropriate amounts of fluids. One reason a community is not appropriately hydrating residents can be related to confusion over the responsibility of hydration. For example, in a larger community, we as caregivers might be thinking it's wait staff that is making sure the meals are served, the snacks are served, and beverages are offered, when in fact, food service is only serving the meals, and it's our responsibility to make sure that the resident is being offered beverages and the appropriate beverages. When a resident is not consuming adequate fluids, frankly, it can be an unnoticed need. You may have a resident that has become incontinent of urine or feces. Let's be honest, when you're walking past that resident or close by that resident, very often you'll pick up an odor that reminds you, oh, I better provide appropriate incontinent care for my resident. If a resident is wearing soiled clothing, we see that, we notice it, and we know to take that resident and help them change into another outfit. But we don't see dehydration immediately. In fact, it usually gets fairly advanced before we're seeing signs and symptoms. So a resident's need for appropriate fluids may actually go unnoticed if we do not have a regular routine set for ourselves. We can also have issues related to the fact of accountability. Most of us have bath assignments. We have laundry assignments. We are held very accountable to go to room such and such and make sure the bath takes place on Tuesday morning and Friday afternoon and so forth. But oftentimes we are not held as accountable regarding documentation and the like for hydration. So it's important that we hold ourselves accountable for appropriately hydrating our resident. Another mistake we commonly make as caregivers is assuming if we give it, they'll drink it. In other words, you might dutifully carry around a tray full of beverages and set a beverage next to each resident. However, if that resident is not stopping, picking up, and consuming that beverage, that fluid doesn't magically enter the resident's body. So it's important that not only do we give the beverages, but we are also making sure that we're looking at how much our residents are actually consuming.
I used to work in a hospital, and we used to have to measure the fluids that we were giving to the patient. We don't do that in a care facility, but we do like to keep an eye on how many fluids that the resident is having. And if we notice that they haven't had enough, we like to let the supervisor know and also let the person with the next shift know that they didn't drink enough and to try and get them to have more fluids.
We are now going to move ahead and talk about some interventions for making sure that our residents are consuming adequate amounts of fluids. Good interventions begin with, number one, identifying your most at-risk residents. Let's just clear the air right now. If the resident has dementia, we are automatically going to place them in our at-risk category. But there can be other residents that are at high risk for dehydration as well. Remember, we talked about some of the residents' medical conditions could lead to this. So know your residents. Ask your supervisor questions. Now, we're very concerned about making sure our residents have adequate fluid intake, but we also want to make sure we never overhydrate a resident that would have fluid restrictions. When we discuss the medical conditions of the resident, we also want to pay particular attention to those residents that may have swallowing disorders. Swallowing disorders, of course, can contribute to dehydration because it's just not comfortable or easy for the resident to consume fluids. We also want to be thoroughly aware if a resident is going to require special beverages, thicker liquids, or they may even require that we use a powdered thickener stirred into their beverages before they consume them. So again, always consult with your supervisor. Planning and scheduling for hydration is important. So when you arrive at work, we all get our little routines and our way of doing things. Make sure, though, that you have incorporated times for hydration within your normal delivery of care. Using a good approach is a critical beginning to encouraging our residents to consume fluids. We want to be very friendly, we want to smile, we want to make it pleasant for the resident. We also want to make sure that we've taken time to learn what our residents' favorite beverages are, and to some degree at what time of day do they like those beverages. So for example, you may have a resident that loves to sip on herbal tea at 9 or 10 o'clock at night. You try serving that in the morning and forget it. They want no part of it. So a friendly approach, knowing our residents, is very important.
I find that when dealing with dementia residents, it's much easier to sit with them and have a drink with them because that encourages them to sit and drink also.
Additionally, we want to make sure at all times in our community we have our residents' favorite beverages available for them. Now you can work with your supervisor, perhaps your supervisor may even involve the resident's family in making sure that their favorite beverages are always available. Some residents will actually store these in their room and be able to consume them on their own in their room. Many times they will be kept in our kitchen and we'll be responsible for serving them to our residents. But learning what their favorite beverages are and making sure they're on hand is a good approach to use when hydrating our residents.
A lot of residents don't really like water, so we give them other things like lemonade and fruit juices, but we like to try and stay away from coffee and soda and tea, things with caffeine, because that really ultimately doesn't hydrate them.
You know, you can actually incorporate consuming beverages into activities so that your residents are used to whenever we get the board games out, everyone's going to get a coaster with a little drink sitting right next to them.
And if they're out on the patio, I'll bring out drinks to them. When they're doing activities, we'll make drinks available to them.
So think ahead. How can I make consuming fluids really a social occasion that they can enjoy with other residents? Now, one thing we always want to remember is that we have not only their favorite beverages available, and we're using containers and serving items that could be a cue or a prompt, but also remember that we want to have beverages available at all hours. Now, this is particularly true in a dementia community where residents are often up in the wee hours of the morning, they're awake, maybe they're moving around, they're pacing, and a beverage is going to be important for them. With our residents diagnosed with dementia, using cues and prompts can be very helpful in ensuring that they're consuming adequate fluids. Something as simple as picking out the right container to serve the beverage in. For example, you may have a resident that has a favorite little yellow plastic cup that they like to drink water out of every morning. Using that little yellow plastic cup is actually a cue, oh, it's time for me to drink some water.
Just smile and be friendly with the resident and hand them a drink, bring it to them. Don't ask if they'd like a drink because they may say no. If you just hand it to them, then they'll take it and they'll be able to drink it.
Even environment can be a cue. For example, some of your residents may be accustomed to enjoying a cool beverage out on the patio. So taking your resident out of doors, seating them comfortably and offering a beverage, no problem. They're going to drink it because that is an environmental cue. I'm relaxing outside. It's time for me to enjoy my beverage. We mentioned earlier that some of your residents may have tremors or physical limitations that make consuming beverages difficult. You may have a resident that has a tremor, and using a flimsy little plastic cup like this is very hard for them to maintain control as they consume the beverage. Giving them a mug or a heavier item is often easier for them to use as they drink their beverage. You may actually have physician-prescribed orthotic devices that the resident may use as well. So always make sure you're consulting your service plan to be sure that you're using the correct devices for your resident. From time to time, you may just be having a tough day with a particular resident. You've offered every beverage under the sun, you've offered it 10 different ways, and that resident frankly just isn't in the mood to drink right now. Don't forget, there are foods that are high in fluids. Now, they certainly will never substitute for a nice big glass of water, but they can help hydrate the resident. In warmer months, think about things like honeydew, watermelons, some of your fluid-rich berries. Popsicles are an opportunity to consume fluid. Now, in the cooler months, you might think of hot beverages the resident will enjoy. For example, they might like a hot broth to sip on, or maybe some nice warm herbal tea they would enjoy. Now remember, we want to stay away from highly caffeinated beverages at all times. Colas that are high in caffeine, or coffees that are high in caffeine. The problem with that is that caffeine acts somewhat as a diuretic. So yes, they're consuming the fluid, but guess what? It's going to pass right on out of that resident very quickly. So while certainly a resident can enjoy coffee and other beverages from time to time, we don't really want to rely upon those type of beverages for good hydration. Be aware of very high-risk times for dehydration. If a resident has become ill, if they're vomiting, diarrhea, or they simply have an infection that's elevating their temperature, that is a particularly high-risk time for dehydration. We'll want to be watching them closely. Be aware of hot days. As the weather warms up, your resident is going to be more likely to perspire and be losing fluids through the skin. You know, if a resident has a particularly active day, maybe they've gone out with their family somewhere, they've gone to the park, maybe with a community outing. While those are all great things to do, those are also times that could potentially dehydrate our residents. So we want to make sure that we think of fluids during these high-risk times. If a resident is having a particular psychosocial crisis, maybe it's depression, they're becoming more withdrawn, apathetic, of course the physician's going to be notified of this, but this is also a time we want to make sure that they are eating and drinking in sufficient quantities. If a resident's highly agitated, highly emotional, the last thing on their mind may be to sit down and enjoy the beverages as they should. So really monitor them closely during these high-risk periods. Adequately hydrating our residents is an important part of what we do as professional caregivers. We touched on the fact earlier that it is so often easily overlooked. I'd like to ask you today to make a commitment to think about hydration each day when you come to work. Get creative. Think of fun, inspiring ways that you can ensure that your residents are receiving adequate fluids.